Hello, my name is Daniel Reeves. I'm a student physical therapist assistant at the University of St. Francis. Can I get your name and date of birth to confirm your identity?
Gage Stiglitz, 10/19/02.
All right, Gage, that's my right patient, so I'm going to go ahead and wash my hands here. I understand that you're having some issues with your left extensor muscles. How's everything feeling today with you?
Pretty good.
Pretty good. You having any pain?
Not really. Probably about 3 or 4.
3 or 4. How does that?
Yeah.
Okay. All right. Well, what I want to do today, Gage, is I want to do some electrical stimulation to try to do some neuro re-education on these left wrist extensors. So we're gonna use some electricity here in our machine and kind of help you to contract that muscle and hopefully get you a little bit better connected to it mentally.
Right.
Does that sound like something that we could do today?
Yeah.
All right. Before we do that, though, I have to clear a couple of things. You don't have any implanted devices, electrical devices.
No.
How about you have a history of blood clots or anything like that?
Nope.
How about cancers?
No.
No seizures or epilepsy? No history of that?
Nope.
Okay. I think we are good to go here. So I'm gonna go ahead and turn on my machine. And I'm going to just check the skin here. You can feel me palpating, correct?
Yeah, a little bit.
Okay. So he does have sensation. The skin looks fine to me. I'm gonna wash it off with water. Okay. Where's your? We just use mine. Alright, so we're gonna go ahead and set up the machine here. So we will select Russian. It's already set to 10 minutes. We're also going to plug in our channels here. And we do have the correct settings down here as well. We have 10-second contractions, 50-second rest times for 10 minutes, so a total of 10 sets. So we're going to go ahead and get our electrodes set up now since we did wash and inspect the skin. So can I have you just do some extension here for me? So I'm going to try to get on the center of the muscle belly here. Can you unflex and then flex it?
Right.
No, you're good. And kind of down here. We'll try that. So let's go ahead, get those plugged in. So I'm gonna just slowly dial up the intensity here. I want you to tell me when you feel it, and we're just gonna go until we get the contraction in the muscle, okay? And then from there, we'll go ahead and start it.
Okay.
So I want you to tell me when you start feeling it.
Feel it.
Feel it?
Yep.
Okay, so we're gonna go until we get a contraction here. Let me know if you're uncomfortable at all.
It's uncomfortable, but it doesn't hurt at all.
Doesn't hurt. Okay. Okay, we got a little contraction of the fingers. A little bit more here. Alright, so we're gonna go ahead and start there. I'll turn it down a little bit. We'll start there. Alright, so you should be getting a rest here in 10 seconds and everything feel okay?
Yep.
Alright, you have a few more seconds here and you'll get a rest, right? Alright. So now you'll have 50 seconds rest and we're gonna do this 10 more times. Or 9 more times rather. For a total of 10.
Is there anything I'm supposed to be doing?
I'm gonna have you go ahead and flex. I want you to try to contract with it because we're trying to have you be able to do this movement without the machine. It's sort of the point of this treatment. So I want you to try to contract with this. And the next one's coming up here in about half a minute. So I'm gonna have you, when you feel it, just try to bring your wrist up with it, okay?
Okay.
Should be coming up here in 10 seconds, alright?
Okay.
And here we go. So you gotta flex with it. Awesome. How's that feel?
Pretty good.
So good.
Uncomfortable. Doesn't hurt.
Alright, so we're gonna go ahead and now that we've done our 10 minutes here, let's go ahead and get you unhooked. Cleaned up here. How's the how's the wrist feeling now?
It's a little sore.
A little sore.
Not too bad.
And you can expect a little bit of soreness from that treatment that we just did, since your muscles are sort of working pretty hard there. You might have a little bit more soreness than normal tomorrow, right?
Okay.
Okay, so it looks like the skin's okay. You can feel me touching here?
Yeah, it's about the same as it was before.
Okay. How do you feel about your pain now that we did that treatment?
It's for sure not a 4. It's probably around a 2 or 3.
2 or 3. Let's go ahead. Could I have you try to do that same motion with your wrist now without it?
Yeah.
It's looking pretty good. We'll go ahead and keep working on that as we progress here, but great job today.
Thank you.
And go ahead and wash my hands and document everything. Have a good one.